Hey everyone, in this video I'm going to be talking to you about how to become a successful ultrasound student in the sonography program, and I'm just going to be touching on basic questions such as if this is the correct career for you, if you actually would enjoy sonography, some requirements that are needed to get through or into the program itself. Um, Also, some changes that you might need to make in your life to actually be successful and get through the program. I'm also going to be talking to you what the program is about of it, and what it actually entails in being an ultrasound student or a sonographer. And I'm also going to be giving you some uh, small or major tips, depending on how you look at it, to be successful in the program. So, is this the correct career for you? Now, the biggest question you need to really ask yourself is, do you have a passion for the human body? Um, this program, depending on whether you do general, tract, vascular, or echo, um, you're going to be getting into some aspect of the body, whether it's the heart, the veins, arteries, or all the organs in the body. You really need to ask yourself, do I care about what I would be doing if I were to be scanning, let's say, someone's kidney or a liver? Um, you need to ask yourself, do you like being around people? Are you a people person? Um, you know, Being an ultrasound, most likely you're going to be around sick people. There's only so many cases you're going to get where people are normal, because unfortunately, being in the medical field, we need to take care of people. Um, you need to ask yourself, how do you feel about being in a hospital setting or maybe a doctor's office and private practice? But that can all be suited or suitable for you depending on which one you like. And basically, the most important question and why we're all in the medical field is, do you like helping people? How do you feel specifically about helping people? Some people may like the practice but hate being around a lot of people, and ultimately that's why we're here. We're here in this field to help others. So, what are the requirements for getting into the program? Well, you need two things. You need to be able to pass the TEAS test. You also need to make sure that you have a GPA of 3.3 or higher. And obviously, the higher your GPA, the better your chances are for getting in the program. Now, what are some changes that you might need to make to be successful in the program? Well, while being in the program, it's going to be very hard to have a full-time job. I mean, it depends on who you are, depending on if you want to work and make more money, depending on if you need to supply for family or whatever the need may be. It will be very difficult to have a full-time job during this program. Now, some of you may have families or children or whatnot that you need to take care of. It would be very wise to maybe talk to an aunt or a family member, grandmother, whoever it is, to maybe watch your kids every so often, because this will take a lot of your time. You will be going to and back from school to get assignments done, scanning done. You can only actually really do scanning assignments in the school because, let's face it, not everyone has an ultrasound machine at their house to use whenever they want. There is very big shifts from light to heavy work, and this workload is not easy, especially getting towards the end of the program, where you're going to be constantly doing work or being at your clinical site and scanning, and it's definitely very taxing, but it is also very rewarding if you can finish. So what is this program about? Well, it's a 2-year program that is going to teach you and train you on really how to become a sonographer in your respective specialty. You're going to learn how to scan. You're also going to learn a lot of different techniques from being at school and also going to scan at your hospital or clinical site. There are 3 different specialty studies that we do in this program in our school, which are vascular ultrasound. You learn about the blood vessels in the body and how to scan them. Echo, where you learn about the heart and how to scan it. And then there's general, where you're basically reviewing the entire anatomy of the body and scanning all the major organs. So some tips that you can use to get through the program. When you are scanning, you need to remind yourself that you're confident. Even if you don't feel confident, saying and believing that you're confident can boost a lot of morale. You definitely, I would say, you need to know the protocol and orientation for each and every organ of the body. You need to trick yourself into saying that you're confident. You just need to scan. That's really what it comes down to. You need to feel free with the transducer. You can't be scared. You need to move it around. You need to get a feel for how it works on the skin when you're scanning organs and whatnot. And you just have to practice. Practice makes perfect. The only way you're going to get better with scanning is if you keep on scanning, practice, especially practicing your weaknesses. That's going to be the #1 way to get better with scanning, to become a great sonographer. So now that you've seen this video, I hope that I guess it shed a little light on maybe your understanding of what to do or what to expect in the program, and hopefully you decide that ultrasound is for you.